Thank you, and welcome. I just returned from the 11th annual meeting of the American Society of Breast Surgeons on Tuesday. And when April had asked me to say a few words here this evening, it kind of gave me an opportunity to reflect on some of the changes that I've seen in the care of women with breast cancer since I started my surgical training 34 years ago in 1976. Breast cancer treatment at that time wasn't complex. The predominant surgical procedure that was offered was a modified radical mastectomy. Since that time, treatment options have been expanded. Surgery, radiation therapy, chemotherapy, hormonal therapy remain the cornerstones of treatment for women with breast cancer. As far as surgery is concerned, breast-conserving procedures are now performed in 70% or more of women, with results that are largely identical to what you would see after mastectomy. This change is based on clinical trials with decades of information supporting the use of lumpectomy as an alternative to mastectomy. Today there are also changes in the way we diagnose breast cancer. Instead of a knife, a needle is used so that a woman can go to the OR with a definitive diagnosis of cancer and have one-step surgery after considering all of her options. Sentinel node biopsy is the standard of care and now replaces routine axillary dissections. Complications are less, and axillary dissection is reserved only for women with positive lymph nodes. MRI has allowed us to refine our image of the extent of cancers in the breast. It improves our treatment planning and offers a woman the opportunity to make a more educated and appropriate decision regarding her surgery. Discovered in the late 1990s, BRCA gene mutations have identified a group of women whose risks for breast and ovarian cancer are extraordinarily high. BRCA gene testing can give families with strong histories of breast cancer more insight into this disease and sometimes dictate the choice of operation for a woman recently diagnosed with cancer. Radiation therapy after breast conservation surgery is a mainstay of treatment. It has been shown to be effective in reducing the risks of cancer returning in the breast. This is, however, a time-consuming process. Techniques of partial breast irradiation using catheters inserted into the lumpectomy bed are now available that can reduce the time of treatment from 6 weeks to 5 days. Preliminary evidence suggests that this is an effective therapy when compared to the more traditional whole breast 6-week treatment. It is hoped that this will make treatment more convenient and expand the use of breast conservation for women who need to travel a great distance for their therapy. Along with more aggressive screening, improvements in chemotherapy have largely been responsible for the reduction in the death rate from breast cancer seen over the last decade. The use of chemotherapy prior to surgery for women with larger tumors can significantly reduce tumor size and expand the use of breast conservation surgery in women who wish to pursue it. Women with positive lymph nodes are candidates for chemotherapy now as they were in the past. In women with negative lymph nodes, however, genetic testing of the tumor itself allows us to perform molecular profiling and select women who will also benefit from chemotherapy. Tamoxifen was not widely available when I trained in 1976, and women who were hormone receptor positive successively underwent removal of their ovaries, adrenal glands, and then their pituitary gland to treat recurrences. Now tamoxifen is the most widely prescribed anti-cancer drug in the world, and newer drugs, aromatase inhibitors, have been found to be even more effective in reducing the risks of recurrence and death in postmenopausal women. For women undergoing breast cancer surgery, our ability to provide them with more comfort in the postoperative period has been made possible with our anesthesia department's use of regional nerve blocks for pain management. We've come a long way. Clearly, our treatment of breast cancer is more highly individualized and more effective today than it was 10, 15, and certainly 34 years ago. There's more to be done, and I'm certain that the future holds great promise.